I thank CAHO for providing me this opportunity to chair this session. And to quickly introduce myself, my name is Mukta Arora. I'm the founder and CEO of Glio Health, a remote patient management company. We help hospitals and clinics provide therapeutic interventions to patients beyond their four walls by using our patent-filed platform, which is built on consortium of technologies from medical IoTs, cloud, analytics, adherence engines, medical communication engine, and AI ML. This session brings a potpourri of ideas and strategies on clinical data analytics, digital workforce, and tracking quality. And we are all aware that technology implementations are not complete without workforce quality as well as data analytics into the pie. We have Dr. Elliot Sloane. Dr. Sloane is a Villanova University Health Informatics professor. For decades, Dr. Sloane has created and taught global digital health workforce development, education, and certification programs for universities, professionals, NGOs, and government agencies. In this digital age, I must say, when it comes to healthcare workforce planning, the traditional approach of simply predicting demand for services and then planning the capacity of clinicians and infrastructure to meet it is no longer adequate. The way and the pace of technological changes coupled with global shortages of healthcare staff requires a contemporary approach to workforce planning. And it'll be great hearing you, Dr. Sloane, on how should we be preparing our workforce for digital adoption. Over to you.
Good evening, Mukta and everyone. Thank you for inviting me to join you. I'm delighted to be here. This is early morning at Villanova University in the U.S. I'm going to tell you a bit about my background and move on to these discussions. Very briefly, 15 years with ECRI Institute, which is the world's largest medical technology testing and evaluation organization. 10 years with a medical device and pharmaceutical manufacturing organization, and now for the past 20 plus years working in the academic area. I'm sort of a Swiss Army knife. I'm one of those fellows who has two sides of my brain. One side of my brain is clinical and biomedical engineering, patient safety, medical devices, all sorts of hospital and practice management. And on the other side is clinical information systems, databases, networks, all the different tools and modalities, cybersecurity, web, cloud, DSS, all of those are parts of the tools that I bring and have developed through my career. Really, the 21st century digital health field is massively cross and interdisciplinary. I've been saying this for 2 decades now in conferences. Healthcare and medical care is a composite of many dozens and many dozens of subspecialties. Clinical and biomedical engineering includes virtually all of the clinical or engineering and science disciplines. And then to add to all of it, these are changing constantly, all of the new innovations in science, engineering, and medicine. So there is no end to this. I tell my students and researchers, if you want a calm and undemanding area, go into accounting, because since the pharaohs, they have been counting rows and columns of information. In our field, you have to be prepared for change tomorrow. So I'm going to give you some comments here about the era and trends, the workforce gaps and needs, some competency tools, and the road ahead. We just published an issue of Dialogue. Here's a link for you to have access to it. It's all devoted to digital health. So many different areas. Dr. Agarwal was the spearhead for this, and my colleagues Manish Kohli and Ajay Nair help pull this together, and I'll be including this in our discussion. There are a number of case studies here. Here's a link directly to the case studies of activities in India, and we are hearing brilliant discussions today and yesterday about all of the innovations and change happening in India. The American Hospital Association just on September 21st released an entire new toolkit for workforce in the digital age. And one of the sections is specifically about technology. And I've included a link for you to get your own copy of all of those discussions. There are so many changes happening. I have been so active in the EHR or the COVID era. These are the case studies and samples of them are available. I'm providing links on almost every page so that you can go directly to this information and get your own copies. In the digital health era, I have been, throughout the COVID pandemic, I have been editing a daily newsletter called Hacking COVID. And I'll give you information about that, but we have everything, dentistry, psychiatry, rehabilitation, consultations on oncology, areas we never thought possible or practical, dermatology, remote patient monitoring, virtualization of medical care, leveraging info technologies in many, many ways, artificial intelligence, digital twins, and so many of these have to be centric for both physician and clinician services to make clinicians' lives easier. We heard that earlier in Apollo Hospital's presentation, and all of the challenges of patient empowerment and participation. Thanks to the pandemic, most relevant peer-reviewed digital health articles from around the globe can be accessed for free. I did a survey about a month ago. According to the PubMed, there are over 10,000 articles on telemedicine, 6,500 articles on machine learning, etc., 20,000 articles on virtual hospital care and home care. The journal, the weekly newsletter that I publish, actually it's a daily newsletter that I publish, Hacking COVID, is all archived. So you can get access directly to these articles. They're free. Here's a link to have access to them. And it includes everything from Iran to the US, around the world sources. It isn't just digital, but an awful lot of the articles and information relate to the digital health transformation. Apple just this month updated their entire portfolio of remote patient monitoring and apps. This is an area of great acceleration. Medtronic just last week identified a partnership with a biointelligence technology. It's called, I think, the Bio Button. This is a technology to allow remote patient monitoring as a medical device. Obviously, Medtronic is one of the largest implantable medical device manufacturers on the planet. And I'll mention just in passing that Medtronic, Philips, GE, everybody in this field is using India as the major source of software development and support. So India has an awful lot of this code and expertise within your own borders. Our own Mrs. Arora has a section in here on digital health adoption and remote patient monitoring. Other colleagues of mine, Dr. Jane and Mr. Cooper, have talked about personalized healthcare. We have a huge number of gaps that we have to look at. One of the major issues is digital health literacy. Physicians, nurses, allied health professionals, government policymakers, families, and patients simply don't have a strong understanding of digital health and all of its aspects and issues, including cybersecurity, including the impacts on decision support systems and data analytics. Also, I think everyone's assumptions and expectations are probably too high because digital health really has lagged e-commerce for about 20 years. There's a lot of work to be done to stabilize and make it perfect. There's a low healthcare literacy in information technology systems and system sciences. Healthcare has similarities to many other e-commerce fields, but there are very unique life-critical aspects of the healthcare applications. And also, people don't understand how novel, chaotic, and inconsistent healthcare practices and processes are, even within an individual hospital or a system of hospitals or doctors' offices. And then government policy and laws simply lag technology in all areas by years or decades. We talk about some of these gaps and opportunities in the workforce section of the dialogue issue. Here's a link directly to that article. Digital health literacy is lacking for physicians, nurses, allied health professionals, and patients and families. For physicians, understanding how the data they're putting in is going to affect a database, data archive, data analytics engine, machine learning. Nurses, allied health professionals, if they don't enter data correctly or in a timely way, or spelling errors, typing errors, all of those will damage the ultimate utility of the systems. Similarly, clinical information systems programmers, analysts, and clinical and biomedical engineers really all have to have a good cross-training and understanding of how the technologies need to work together in order to provide seamless, safe, reliable healthcare. There are a number of sources for digital health competency training and professional certification. I've listed a number of these. The first one is the American College of Clinical Engineering. The second one, the American Medical Informatics Association, the American Nursing Informatics Association, and our good friends at HIMSS. And these are links to those certification and training programs. At the top level, if you're looking from the top down in organizations, skills and knowledge, there's a new program that we put together, the certified professional in health technology transformation. We have candidate handbooks I've listed in each of those that you can get details of what are the domains of knowledge for leaders in each of those fields. In order to earn these certifications, you have to have 15 or so years of experience and an enormous amount of background and knowledge in order to qualify for these exams. I'll drill into some of these very shortly. The CP HIMSS at the bottom is probably the ultimate level for most senior managers in the health informatics area. Mid-level, mid to senior people also would be using some of the CP HIMSS certification. Chief technology officers, COOs, clinical and biomedical engineering managers might be looking at skills and trainings like the ACCE certification and also the Certified Information Systems Security Professionals. And then entry and career level. New students, people who are just joining the healthcare field from military or from banking or from database or cloud services, they need to also understand the vocabulary, the language, the coding, the nomenclature, the interoperability, so that we develop the Certified Associate in Healthcare and Information Management Systems. And then there's so many undergraduate and graduate programs, my own at Villanova University, Oregon Health Sciences, which really looks at the higher end of bioinformatics and physician informatics, and Imperial College, which looks heavily at data analytics and artificial intelligence. When you've seen one academic program, you've only seen one academic program because each one looks at different areas and aspects of this field. For the Certified Professional in Digital Health Transformation Strategy, the new HIMSS certification, we have 4 major areas: digital health ecosystems, personal enabled health, measurement and improvement, and strategy, governance, and organizational management. I've broken this out to let you see the 22 specific topic areas that are covered in this. And obviously, everyone is not going to be a Swiss Army knife with 200 different pieces coming out of it. We're going to need a lot of different people with a lot of different skills that overlap and cross-training in these areas. But as a manager, as a leader of digital health transformation and strategy, some working knowledge of almost all of these fields are essential in order to be able to help the field and organization and government move forward. The road ahead for digital health, this is very much a team sport. We have diverse skills. We need men and women from all areas and aspects of our health community, including the patient and families. More and more patients and families are given more and more responsibility today for participating in their care. Critical success factors in my mind at all digital health levels: attention to detail, attention to detail, attention to detail. Spelling matters. Punctuation matters. Decimal points matter. Data has to be entered immediately, not an hour later, 2 hours later. Automation is necessary in order to get some of these things to work. Big things are built one brick at a time. These kinds of systems don't happen overnight. They happen day by day, week by week. You have heard your colleagues already talk about the work that is happening. Critical also is systems thinking. You cannot look as a silo at only one aspect of healthcare, healthcare automation, or healthcare information systems. The American Medical Association just published a beautiful webpage and resources on the systems thinking that's necessary for physicians and people in this field. Digital health is going to create healthcare 3.0. Mr. Singh, just this past year in Forbes, has written a beautiful article about healthcare 3.0, and really it's a precision fusion of human and technical resources to create a symphony of health and wellness. And that is a great opportunity, and this is a picture of the Indian Philharmonic Orchestra. CAHOTECH 22 shows that India has the technical, scientific, and medical knowledge and skills to become a world leader in digital healthcare. India could leapfrog ahead in this decade. A lot of the US and Europe is stuck in legacy systems that will take decades to undo. I'm honored to lend my support to your efforts, and my clinical engineering and HIMSS colleagues are honored as well. Thank you for the opportunity to share these thoughts. I hope this becomes part of a long-term ongoing discussion and dialogue with you and our community about how we can improve healthcare for you, for our families, for our nations, and for the world.
Thank you, Dr. Sloane. It indeed was very, very insightful and full of knowledge. As far as the skill set is required is concerned to really transform digitally. It's not just the skills, but what certifications are needed, what kind of universities are providing these certifications, and how HIMSS and University of Villanova can really help us bridge these gaps that we have today to be able to really go the transformation journey. Thank you so much again, Dr. Sloane.
Pleasure to be here. Thank you for inviting me.